The first step of the procedure is to verify the medication order on the patient's chart and compare this to the MAR. You're going to locate and verify each of the 5 rights. The right patient,
John Jones, John Jones.
The right medication,
Morphine sulfate, morphine sulfate.
The right dosage,
2 milligrams, 2 milligrams.
The right route or route,
IM intramuscular, IM intramuscular.
and the right time.
30 minutes prior to dressing change. 30 minutes prior to dressing change, and it has not been given in the last several hours.
This is the first check for accuracy. Next, you will verify patient allergies on both the chart.
Physician's orders penicillin, medication administration record, allergy to penicillin.
So you've compared allergies both on the chart and the MAR. Next, you perform hand hygiene. Perform hand hygiene. Select the correct medication and compare the label to the MAR.
Morphine sulfate, 4 milligrams per milliliter. I'll have to calculate an amount to administer, which will be, for 2 milligram dose, will be 1/2 of a milliliter.
Check the expiration date on the medication container.
It's not expired.
Verify the correct time for administration of the medication.
It's 30 minutes before the dressing change.
It's right time.
In choosing the equipment for an intramuscular injection, we'll be using a 3 milliliter syringe, a 23 gauge 1-inch needle. We'll be using a needleless system for withdrawing the medicine from the vial. We'll need an alcohol swab to cleanse the vial. We've already identified our medication as morphine. This particular concentration has 4 milligrams per milliliter, and our dose is 2 milligrams. Therefore, we'll be giving 1/2 of a milliliter. The first step in preparing the injection is to cleanse the top of the vial. Next, we'll use the needleless system. Attaching it to the syringe, maintaining sterility. We're going to withdraw an amount of air equal to the amount of dosage, in this case 1/2 of a milliliter. Insert it into the vial and push in the air. At this point, it's acceptable to draw down more medication than will be needed to be sure that we've filled up the syringe completely and that we have room to remove any bubbles that could affect the dose. After large bubbles are removed, we would correct the dose, being sure that it is at the proper level for the correct dosage of medication. At this point, we're finished with the vial. However, in order to remove the needleless entry device, we need to cap it again because we never recap. We always use the scoop technique, even on a sterile needle. removing the needleless entry and disposing of it properly. Then again, using sterile technique, we attach the needle. Secure it in place using the lure lock. Now that we have finished drawing up the medication, we will verify the medication again. Morphine sulfate, 4 milligrams per milliliter. Morphine sulfate, 2 milligrams, so I'll be giving a half of a milliliter. And here I have a syringe with a half of a milliliter.
Verify medication dose with another nurse if indicated. Verify calculations. Compare the prepared medication with the MAR and the label of the container for right patient, right medication, right time, right route, and right dose for the second check of accuracy.
Morphine sulfate, 2 milligrams, which will be a half of a milliliter from this solution. 30 minutes prior to dressing change, intramuscular. I've also prepared a label that I can affix to the syringe that also has the patient's name, John Jones, the drug name, morphine sulfate, the dose, 2 milligrams, and the amount I'll be administering, which is a half of a milliliter, 0.5 milliliters.
Proceed to the patient's room with the MAR and the medication with the appropriate label on it.
3.
Perform hand hygiene. Correctly verify patient identification using 2 identifiers, comparing the patient's armband with the MAR.
This is patient John Jones. John Jones. His birth date is 2/15/48. His medical record number is 792-4328-4328.
Assess the patient for an allergy band and ask the patient about allergies.
I see you have an allergy band to penicillin, Mr. Jones. What kind of a reaction do you have? The medication I'm giving is not penicillin, so it should be okay. Thank you.
Reassess medication with the MAR, checking the 5 rights before administering.
This medication is for John Jones. It's morphine sulfate, 2 milligrams, IM, 30 minutes prior to dressing change.
Explain the procedure to the patient.
Mr. Jones, I'll have to check feel of your hip area to make sure where I'm going to give this, and then I'm going to give you the medication. I'll let you know right before I give it. It'll be just a little stick.
Raise the bed to a working height and lower the side rail. Apply clean gloves. Select the appropriate injection site, locating the site by using appropriate landmarks, exposing only the injection site.
Today we'll be using the ventrogluteal site. I have located that using the greater trochanter, the anterior iliac crest, making my hand in a V, and using this V-shaped area in the upper hip area.
Assess the integrity of the muscle or skin for any bruising.
Not seeing any bruising, and this is good muscle.
Properly clean the injection site.
I'm going to use a circular motion with an alcohol swab to clean the area. I'm also going to leave my swab pointing toward the area where I have cleaned and allow it to dry.
Remove the cap from the needle. And spread the skin tightly or grasp the muscle as indicated according to size. Inject. Aspirate for blood return. And inject medication slowly. Remove your needle and apply gentle pressure. Do not massage the site. Activate your safety cap. Assist patient to a comfortable position. Raise the side rail. Dispose of your needle and syringe if not already done. Remove gloves correctly. Perform hand hygiene. Observe patient for any allergic reactions. Document on the MAR, including documentation of patient's response for medications such as pain medications. This is your right documentation, the 6th right.